So I find this stat to be pretty interesting. In research done with women who had persistent hypothyroid symptoms even after taking medication, 2/3 of them saw resolution when they restored their ferritin levels to 100 micrograms per liter. And this isn't the only study that shows the importance and the relationship between iron and good thyroid function. So if we know it's important, why is there hesitation about assessing it and therefore taking it? And I think the reason comes back to iron overload can also be a problem, and we know that iron in levels that is too high for our body can cause increases in reactive oxygen species. So what we will discuss today is properly assessing the situation regarding our thyroid and our iron levels, looking at people who are at higher risk of having low iron, what ferritin means and assessing those proper levels, and also determining where the confusion comes with certain doctors looking at your ferritin levels. So hopefully if we can address all those different aspects, you can have a much better handle on knowing whether or not iron supplementation or iron infusions could be a therapy that could work for you and help you out with some of your low thyroid symptoms. My name is Dr. Bodle, and I specialize in helping women with Hashimoto's and low thyroid lose weight and improve their energy naturally. And one of the key factors in achieving those goals is assessing micronutrient status, one of which is iron. Now, when it comes to people struggling with hypothyroidism, they are at increased risk of low iron status for a number of reasons. And if we just look at things generally, the reason that we can have low iron is because we are either not absorbing it properly or we tend to lose it more readily. So when we start talking about people who have changes in iron absorption, we're of course going to be focusing in on the gut. Now, this can manifest in a couple different ways, including things like low stomach acid or inflammatory gut conditions. Now, with low stomach acid, that can be caused just by hypothyroidism in and of itself. And we've talked about how we can have changes in digestive enzymes and gastric secretions when we have low metabolism. But that can also be affected by things like proton pump inhibitors and other acid-lowering medications. The reason for that is the acidity is really critical for breaking down food and liberating iron from that food so it can be absorbed. And if we don't do that, it doesn't allow us to have proper absorption and function in our small intestine where most of that iron absorption takes place. In regards to inflammatory bowel conditions, that can include everything from autoimmune gastritis to celiac disease to irritable bowel syndrome, all of which are common comorbidities and will also decrease the amount of iron absorption into our system. Now, when it comes to people who are losing their iron more readily, this usually occurs in the form of blood loss, which makes women a bit more susceptible than men due to the fact that things like menstruation and pregnancy can play heavy roles here. But things like gastrointestinal bleeds, including ulcers or hemorrhoids, and parasitic infections can also lead to these types of changes. So these can affect both men and women, and we need to be aware that they are possibilities. So if you fall into any of those categories and think you might be at risk of low iron status, you'll want to make sure to include an iron panel in your next set of blood labs. But something that's really important to note is that a lot of doctors don't include that iron panel. They will only look at red blood cells and hemoglobin to assess if there's any anemia present. But people can have low iron and all the symptoms that go along with that and not have anemia. And so those things don't necessarily occur at the same time. This is why the iron panel is so important to be included. For a complete iron panel, you'll want to see the markers serum iron, transferrin saturation, iron binding capacity, and ferritin. And the reason why it's so important to have the full panel is because, although we would like it to be, assessing iron markers is not super straightforward. So by having multiple data points, it can give us more information about how your system works instead of trying to make a decision on a single data point. Now, our focus today is going to be ferritin. And the reason for that is because although those other markers are helpful and they can guide us, in most circumstances, ferritin is a reliable marker for iron stores. But the key thing to understand is that ferritin in and of itself is not iron. It is a protein which stores iron. Therefore, it is susceptible to other changes in the body besides just iron status, and that's where a lot of the confusion can come into play. So besides being a storage protein that exists both within our cells and to some degree within the bloodstream, ferritin is also what we call an acute phase reactant or an acute phase protein. And that means that it can increase in situations of inflammation independently of iron status. And I'm going to say that one more time just because it's so important. Ferritin is a protein, and although it can help us understand our iron stores, because it is an acute phase reactant, it can increase in serum quantities irrespective of iron status. In fact, in research done on people with diabetes and obesity, they found ferritin to be an unreliable marker for iron status because in these patients, it was often increased due to the inflammation associated with their conditions. And other studies have noted that the interpretation of ferritin can become difficult where chronic disease or infectious disease are commonplace. So what this all boils down to, and what might be most important for you, is that inflammation can obscure potential iron need. So let's say, normally speaking, your iron levels, your ferritin levels are lab low. They're less than 15 micrograms per liter. But maybe you have some sort of potential inflammatory condition, and that could be related to your thyroid, your gut, your hormones, whatever it might be. When that inflammatory condition persists for a period of time, it can increase the level of acute phase reactants in the bloodstream. One of those is ferritin. And when that happens, when we look at your blood labs, we may see ferritin within the normal range. But it's not within the normal range because of an improvement in iron status. It's in the normal range because of the increases in inflammation. And this is why I think you'll tend to see studies that show a bit of a mismatch between serum levels and actual iron status, which is determined by the gold standard of bone marrow biopsy. But because it's a little bit more invasive and definitely more expensive, it is very rarely used except for in extreme circumstances. But those kinds of studies have seen that about 25% of women with normal ferritin still have low iron when they are checked by the gold standard testing. So if you're someone who falls into one of those categories that we were talking about earlier, has a history of low iron and anemia, and continues to experience symptoms like exhaustion, fatigue, brain fog, hair loss, and brittle nails, but your labs keep coming back normal and ferritin is within the normal lab range, that really doesn't pass the sniff test to me, and you're going to want to do some additional digging to figure out how do your iron levels relate to other factors in the body and how are they being impacted by things like inflammatory markers. So as per usual, I may have over-explained things a little bit and maybe given too much background information. But I want us to be clear on this stuff, and I want us to make sure that we're on the same page regarding the fact that since inflammation can change markers like ferritin, we have to realize that things like thyroid conditions and gut conditions directly contribute to inflammation. And even though I've poked holes in some of the ways that we look at ferritin, ferritin isn't necessarily a bad marker, but we have to make sure it's assessed with the patient and individual's health history and their current status in mind. And the unfortunate thing is that when a lot of doctors look at this stuff, they're not treating everyone differently like they should. They're treating everyone the same. And for one person who may not have thyroid issues, may not have gut issues, but is suffering from a simple form of iron deficiency, they can be completely different in their response and their overall picture than someone who is having some more of these complex health issues. So here's how I recommend approaching these situations where someone may have a potential need for iron. First, we want to start by looking at the health history. If there's a history of low iron, a history of anemia, then we definitely have a red flag here and we want to be on the lookout for iron changes. Next, we're going to look at inflammatory markers. Things like C-reactive protein, fibrinogen, homocysteine, and vitamin D. If those first three markers are elevated and vitamin D is depressed, then we know we're looking at a situation where there is systemic inflammation, but we don't always know what is driving it at this point. From there, we can move on to our iron panel. And again, that should include serum iron, iron binding capacity, transferrin saturation, and ferritin. And we can start to look at what the trends of all those markers look like together and start to make some decisions about it. If we look at our inflammatory markers and they're all within normal limits and they look good, then there's less likely to be systemic inflammation, and that means that the ferritin value that we see on our iron panel will tend to be more reflective of iron status. However, if our inflammatory markers are elevated, then we have to adjust our thinking regarding that ferritin value. Due to the fact that ferritin is an acute phase reactant, as we said before, it can be elevated due to the inflammation, not due to changes in iron status. Based on my clinical experience and looking at the research, people who don't have inflammatory conditions may benefit from iron supplementation if they are under 50 micrograms per liter. But for people who do have some sort of chronic inflammatory condition, then that benchmark gets moved up to 100 micrograms per liter. But even with those recommendations, it can be a little confusing sometimes, and it can be hard to know whether or not your symptoms constitute an inflammatory condition or not. Also, maybe you only have 1 or 2 inflammatory markers that are elevated on your labs. So is that ferritin on your labs reflective of iron status, or is it reflective of inflammation? But in those types of situations where there is some discrepancies, what I recommend is that we kind of take care of the low-hanging fruit first. If you have some symptoms which are associated with inflammation, change your diet, work on your exercise, make sure you're getting proper sleep, and de-stress as much as possible. Once you do that, you can then go back, rerun your labs, and see if there has been any changes in your ferritin status. If you've seen improvements in how you feel and your ferritin has dropped, then that is indicative of the fact that the ferritin marker you looked at previously was likely being influenced by inflammation, and now the marker that you're seeing is more reflective of your actual iron status. If there is no change, then that was a true value and true representation of your iron status, and you can trust that moving forward to give you a true or proper reflection of where you're at. Once those initial aspects of our health have been taken care of and we still feel as though we could benefit with some iron supplementation, I would recommend choosing a supplement that includes ferrous forms of iron rather than a ferric form of iron. That tends to be the form that our body absorbs iron most readily and should give you a little bit more bang for your buck. That said, although inorganic forms of iron can be effective, the best and most absorbable forms of iron are heme-based iron. So if we can increase the amount of red meat or organ meats that we're consuming, these tend to be the best ways of delivering higher amounts of iron into our system in a hyper-absorbable format. But if you have any questions about the nuances of iron supplementation or a particular product that you may have been looking at, you can always leave that in the comments box down below. So to recap the key points from today's video, they are that our thyroid gland needs iron to work appropriately. But hypothyroidism and other conditions that tend to go along with hypothyroidism often contribute to decreases in iron absorption and increases in iron loss. Now, the way that we assess that is through a full iron panel, but one of the key markers is ferritin. However, ferritin isn't just a protein molecule that stores iron, it's also a protein that can increase in specific situations of inflammation. Now, all those conditions that we just mentioned before that contribute to poor absorption and iron loss, they can also cause increases in inflammation. Therefore, if ferritin is elevated due to the inflammation, it can actually obscure an iron deficiency or an iron need. So to make sure we are addressing that appropriately, view ferritin within the context of your situation, of your health history. And once you do that, then you can more effectively determine whether or not ferritin supplementation is something that will be effective in helping you to resolve your symptoms. If you'd like more information about how you can support your thyroid and improve your health overall, make sure you check out some of my other videos or grab my free download, which is titled 109 Foods to Boost Your Thyroid and Improve Your Energy, which you can get from the link in the description box below. Otherwise, thanks so much for hanging out with me and sticking with me to the end of the video today. Hopefully you found it useful and educational. If you liked it, give it a thumbs up, and if you haven't done so already, subscribe to the channel. My name is Dr. Bodle. I think you guys are all amazing. Thank you for taking the time to invest in your health. I hope you're doing well, and I'll see you next week.